Hey,
What is up with your life? They hate for no reason. Look in my soul, look in my dreams too much. But they still hate on me.
yo boy.
But it's all with God.
So when you pray, please don't forget to pray for me. Hey, so when you pray, please
Another
don't
episode of
forget
Mic
to
and
pray for
Purpose
me.
Podcast. Ladies and ladies, it's your only host, Peter the Hustler. So welcome to another episode of Mic and Purpose. On our platform, we say nothing but the truth as long as you're under our custody. This mic is the one that will be speaking to us. So, ladies and ladies, welcome to the new episode. So today I'm not alone. I'm with my brother. He's my friend, he's my brother, he's also my doctor, Dr. Eddie. So allow me to introduce you to my brother. How are you, my brother?
Hey, I'm good, my guy.
Welcome to Mic and Purpose, my guy.
Thank you so much for inviting me and giving me this opportunity.
You're welcome, my
Really
brother.
appreciate it.
So, my guy, before we go any further, you can introduce yourself to the audience.
How are you guys and all the viewers? Thank you guys for watching us, and we had to talk about an interesting topic. Hope you guys will love it. I'm Dr. Edward, and
So, ladies and ladies, this is Dr. Edward. So, right now, tighten up your seatbelt because we are about to drive you crazy. Ching! So, my guy, how are you doing, my brother?
no, I'm good, man.
You good, my brother?
Just under this weather.
Today I even thought that it was gonna, rain or something, bro. Even my brother here, he was saying to me that I should, carry an extra bag with a jacket. I was like, nah, man. Let's just keep that shit, bro. Let's keep it real. But I'm happy that you are here, my brother.
No, I'm also happy to be here.
You're welcome, my guy. So, let's start our journey. Let's get it deep in the conversation. So, allow me to ask you, who is Dr. Eddie?
Right. Let's start from where it all began.
Exactly.
So, high school, I was at Prince Edward.
Mm-hmm.
Did my A-levels there.
All right.
And then from there, I applied for medicine at WITS.
Okay.
So I didn't get in the first time.
Yeah.
Then I decided to go to MGI
Okay.
here in South Africa. So then I did my first degree, which is a Bachelor of Science in Biomedicine.
Okay.
Yeah, so it was a 3-year degree, finished that. Then I did my honors
Okay.
at University of WITS. So I did a Bachelor of Health Science in Molecular Medicine and Hematology,
Wow.
which
Shout
was
out.
1 year.
Shout
And then
out to
from
you, my
that-
guy. Yeah.
That's when I did medicine.
Is it?
Yeah.
So, if you don't mind me asking, out of all those courses or out of all those programs that we have under the planet, why did you choose being a doctor, my guy?
Medicine is my passion.
Yeah.
I love helping people. I get the satisfaction when people are well
Yeah.
and healthy.
Yeah.
So for me, it's not work. It's a hobby.
It's a hobby.
I enjoy it.
And
I love it.
your hobby, I love it because it's not just only a hobby, it's also a gift. Because at the end of the day, if you love helping people, not everyone loves helping you, my brother. Because I remember there's a certain time when I tried to do nursing, my guy, the first time I tried doing that, it was okay because remember, it's still in theory, you're still happy, because you're wearing this white uniform without no badges on. You're okay, you're doing these theories, and then, everything is going well. But then the day of the practical, now they're telling me that I should inject this other person, my guy, that was seriously sick. I must, put the drip on him and stuff like that. Yo, bro, I panicked. What I just did there, I left the hospital, I went straight home. I never returned. So that's why I'm saying that at the end of the day, it's a gift. Understand? And then I'm proud of you because at the end of the day, you helped me. You are still helping me even. You are helping even my family. So shout out to you, my guy. So how was the journey, my brother? Let's say now You are done everything now. You're a graduate. How was your first task, if I may ask you?
The journey, it's tough.
It's tough.
It's challenging.
Yeah.
Medicine, it's draining both physically and emotionally.
Mm-hmm.
And most people, they view it as a way of income. Like if you're a doctor, you make money.
Yeah.
But then they don't look at other things.
That you face.
The time, emotions, what you deal with, the psychological trauma, emotional trauma.
Mm-hmm.
So that part, a lot of people, they don't look at it from that point of view.
So if I may ask, sorry I cut you there, my guy, but if I may ask you, do you have a specific field that you can say, as a dog, I can't do this, I only do that, or you are able to handle everything?
No, I'm able to handle everything.
Shout out to
everything. But what excites me more is emergency medicine, trauma, and obs and gynae.
Ladies and ladies, as you are hearing my brother here, he can handle everything. So if you're out there, you need a doctor right now, no matter what the circumstance, no matter what kind of disease you are suffering from. We got my brother. I got Dr. Eddie in the house. So we can go on, my brother. We can go on. I'm very happy that you are here with us, man, because it's a privilege, it's an honor to have you under our custody, man. A lot of people, they are going through some challenges. Some of them I know, they can't speak it out. Some of them, they are shy to approach the friends. Some of them, they're shy to approach the brothers, the siblings. So whatever condition that person is facing, he doesn't mind on sharing it on himself. So I'm sure with this episode, we're going to be able to help lives outside there. You understand? So I'm very happy, my guy, that you are here with us, and then we are getting it done. So now, you're a graduate now. You started working. Where did you start working, if I may ask?
So at first, I went back to Zim.
Okay.
Yeah. So there's one of my fathers there.
Yeah.
So then I was working there by his company, and then doing some medicals, and then also working together with the government in screening things like TB, cholera, because that time I was working like in the rural area.
Oh, okay.
Yeah.
Okay.
So we were doing like more of health promotion.
That was
and
good.
Also to help people.
But how did you feel on doing all those
good.
things? Yeah.
For me, it's good. I can wake up any time of the day, as long as it means that I have to help somebody else.
Oh, that's good, my brother. Keep it up, my brother. Keep it up. So now, after you have completed, that task for cholera and
TB and all those.
TB and all those kind of natural born diseases. Like at the end of the day, what was next?
So next, then I decided to come back to SA.
Okay.
Yeah. So then at SA, then I was working at the government hospitals.
Well, okay.
As usual. So I was with one of my colleagues, very close friend of mine. We also studied together from day one. And yeah, so it was nice being back in the field as well. And then now I'm practicing as a GP, as a general practitioner.
Oh, shout out, my guy. Hey, I can hear it's not an easy journey, bro. You have been through it all. But at the end of the day, maybe there's someone outside that is willing to do the same thing, but the person is afraid, scared. What if a patient dies in my arms? What if I can do it wrong? And then he's doing something that he's not even loving right now. But at the end of the day, I'm with you under our platform, and I'm sure we're going to help someone that is watching us right now. So look, man, before we go any further, let me take you back now. Someone can see you glowing, shining like this, my guy. People would love to know, is Dr. Eddie married? That's the first thing.
So Dr. Eddie, I was married.
Yeah.
Right, but then things didn't go well as planned.
Okay.
Then I ended up getting divorced.
Okay.
And then now I'm in a stable relationship.
Yes, you are hearing, ladies and ladies. We have a hyena in the house. Dr. Ed is speaking it all. He's saying it all. He's even saying that he was married, but then things didn't work out, so he's a divorcee. But now he's not searching because he's in a stable relationship. I love that, my guy. So being a doctor, is it something that you always wanted, or like it's something that came up when you were growing up?
So ever since I was young,
Yeah.
my mom told me that when my younger brother was sick,
Okay.
because we are six in our family, so
That's good.
I'm number five.
Okay.
So my younger brother, the sixth one, every time when he was sick, then I'd always check up on him and saying, are you okay? Or are you sick? What's wrong? So she's the one who actually saw the passion in me that, my son, one day you're going to be a doctor.
Wow.
But during primary school, when we're all kids, all we just focus on is just playing football, not even doing homework. But then it hit me now when I was like in Form 2. That's when I know, like, man, I have to get into sciences if I need to achieve my dream. That's when I started getting serious with school. Then after that, it was always in my heart that
I want to be a doctor. Yeah.
Come rain, come thunder.
So now we are saying, ladies and ladies, dreams do come true. As you are hearing from my brother right now, he's uttering nothing but only the truth. He's telling me that as he was growing up, it happened that he really wanted to be a doctor at an early age, because even if his siblings were getting sick, he would try by all means to help them. Try by all means, to try to find out what's wrong with them, So we can say this guy was born with a gift of trying to help those that are in need. So shout out to you, my brother. Shout out to you, my brother. So let me tell you guys the topic of today. I talked to my brother that what kind of topic should we have under our custody, under our platform, or something that we can start out with. But then the topic of today, we both agree that we are going to talk about infertility. So, Dr. Eddie, now you're a doctor, no longer my brother now. So I'm your patient. And obviously you're still my doctor. So if you don't mind me asking, what is infertility, man?
Yeah. So infertility is when a couple, whether they had kids or child before, or they've never had any kids, but they're trying to have a child, and then they cannot conceive in a space of 12 months. Then that's when you call it infertility.
Okay.
Yeah. And then with some other countries or states, they say that if a woman is around the age of 35 going forward, and then if they can't have a child within the next 6 months, they also describe it as infertility.
Oh.
Yeah.
So if I may ask you, do we have like types of infertility?
Yeah.
Okay.
So we categorize it.
Okay.
So into two main groups.
All right.
So we say there's primary,
Yeah.
and then there is secondary.
Yeah.
So primary infertility, meaning that you've never had a child,
Yeah.
and then now you're trying to have a child, but you still can't have a child.
Okay.
That's primary infertility. And then secondary infertility, that's when a couple or a person or your spouse has a child, but now they can't conceive.
Oh, okay.
The child. Then that's secondary.
So let's start with the primary infertility now. Let's get inside the primary infertility. So you said primary infertility is when a couple is never conceived. You see. So what I want to ask there now is how many months do you consider that, like now, okay, if I may say, how many months can you say as a doctor, after these months, we can say now this is infertility? Why am I asking that question now? Because there's someone that can watch us right now, and maybe they've been in a relationship with the person that, you know, he or she is loving, and then at the end of the day, you may find out that, like, these people, according to them, they are thinking it's something that is normal. You understand? It's something that is normal because, you know, they are thinking like, no, one of these days, you know, we can be able to conceive, we can be able to have a child. Maybe it's not the right time or something like that. So I want those souls to be helped, man. You get the sense? I want those people to have knowledge, to have wisdom, so that at the end of the day, they don't live under the shadow. So allow me to ask my guy, how many months can you say, you know, this is when you can say now it's primary infertility?
Okay, so for us, it's usually 12 months.
It's 12 months.
So 12 months, so if you try to have a child and then you fail within 12 months, and then with regards to that, you never had any child, or you don't have any children at all.
So those are 12 months,
12 months,
less and less of regular unprotected sex. Tiri kuti ndo mwedzi inokwana kuita gore vanhu vachirara vasina kudzivirira, pasina chiri kuitika. Ukaona une mudiwa wako ka makatorara, you know, musina kudzivirira, mapedza gore pasina chiri kuitika. Doctor, it's not normal, handiti?
vanenge vakuda rubatsiro. Yeah.
So that's what we are saying here, ladies and ladies, that if you are having your partner, and then at the end of the day, you guys are living under each other's custody, loving, daving, 12 months, boom, 1 year gone, no child, but you guys are having unprotected sex, still there's nothing. That means you guys, you need serious help. So that's the stage number 1, which is the primary infertility. So let's get into secondary infertility now, my dog. So you said secondary infertility is when a couple is conceived before. So it's either it's a male vision or a female vision, but one of them is having a child with a different partner, which is not the partner that they are dating. So meaning that at the end of the day, these guys now they are dating, but they can't have any child. Is it?
Yeah.
So that's when you see Mike is having a son somewhere, and then Mike is married now, but Mike cannot give birth with his current girlfriend, with his current wife. That's what we call secondary infertility, right?
Yeah.
So, if I may ask my dog, is there something that can help with those, situations? Like, let's say perhaps we have touched the primary, we have touched the secondary. So let me just say, the whole thing, is there any solution?
Yeah. So we always try by means to help couples, to help them conceive. But first, where we start from is just like any doctor, they'll start from history. So we need to know your background history from both the men and women. Because some cultures, they say, no, if couples cannot conceive, it's most likely the problem of the woman.
Oh, okay.
So that's what most cultures say, or most people say. But forgetting that, no, when it comes to infertility, there's vanhu vaviri ava. Saka problem ingona iri kune murume kana kuti iri kune mukadzi.
Saka tiri panyaya iyoyo kureva kuti panapa futi pachava ne-age impact, handiti? Pakati pekuti kana kuti vangave vakadzi kana kuti varume.
Yes.
Pane age impact.
So age also.
And it
also contributes.
So let's just start kuti pavakadzi facility yacho inotanga kudecline from what stage, and then around what age futi painozota sharply after.
Saka for vakadzi, usually we say once a woman or a girl starts menstruating, right, from that point onwards until menopause, then chance of them getting pregnant goes down.
Okay.
But as a woman, when they reach the age of 35, that means that could their eggs, right, in terms of quality, it declines.
So that means
that's when you hear that people saying that once you're 35 and above, there are chances that of you getting pregnant can be slim, and also you might have children with genetic conditions such as Down syndrome, because the quality of the eggs goes down. Even if you try to donate, they'll tell like, no, women who donate eggs, right, it has to be maybe between around the age of 18 and 34, because that's when you get the most good quality of eggs.
So, ladies and ladies, right now, I think you have heard it all. You guys, I think you guys should stop, saying, I didn't cheta mwana, zvangu zvaita zvakanaka. Zvaita zvakanaka yako inozobuda kuma 36 years. Once wadaro, machances ekuwana vana vakaremara, vana vane Down syndrome, they are high. So true, this also from the age of 20, maybe 26, 25 to 34, to panenge pachikwanisa kuumbwa vana vanenge vane utano hwakaita sei hwakanaka. So tikuti isusu vadikani vateerereka, hazvina kunaka kuti munhu woda kuzozvara wakuma 35 36 uchida kuti ndiyo first born yako, kana vanhu ndokutaura nenyaya ndakatageta anonzi maslay queen nemaslay king, kuti munenge muchida dutumadza muchiita sei. The moment now you are trying to sit down kuti uchiita vana, unokwanisa kuvaita, unokwanisa kusavaita sezvataura doctor panapa, but kuvaita kwako kuri riski futi, because unokwanisa kuita mwana wacho obva abuda ane utano usinoita sei usina kunaka. Saka pabatisisei. Alright doctor. Saka mataura imi mukati also tine matype maviri, which is primary and secondary. So ndikada kuzvibreaka down foot, primary and secondary inobva involve both males and females.
Exactly.
If we combine those two now, it becomes a male and a female infertility. So anasika atina vakadzi munomu, saka tinotanga nemale infertility. So if I may ask, in male infertility, how can one know kuti maybe ane infertility ari munhu wechirume?
So first, sevarume ndizika vamwe taura kuti unoita ana 1 or 2 vana musango.
Okay.
But you waona manje waona kuti no, here handina kana mwana, even with my current partner, I'm struggling to have kids. And then maybe your partner has kids or your partner doesn't have kids. Then unofana kutanga kuziva kuti no, there is something wrong.
Okay.
Unofana kuziva kuti there is something wrong. Saka kana takuta savarume manje, then there are different number of causes of infertility in males, right? So some of the causes includes trauma to the testicles. And it can damage the testicles, and then it can lead to complications that later on will prevent you from having children later on in life, like gentlemen who play sports such as martial arts or any contact sport.
Maybe.
So that's why they wear my groin guards to protect rume wao. So trauma can be one of the causes. And then my other causes, it can be genetic causes.
All right.
From a young age, maybe wakazvarwa une certain syndromes, right, that will stop you from having normal sperms with normal DNA in them. So that can also contribute to that, like children with Down syndrome or children who are born with cystic fibrosis. So it can also stop them from having kids. So it can be those genetic diseases. So it's a list. So So trauma, genetic diseases, and then another thing is infections. Infections such as my STI. So we can group them as STIs. Because what happens now is that when you have an STI, some people, they don't go to the doctor immediately. They wait until, even after seeing that
critical,
there's drop, some they call it as drop.
Okay.
Even if they see the drop, they don't go to the doctor because they're shy, or they believe that if I drink this or that, it will clear it. So now it will end up now moving from the urethra, going all the way down to the testicles, where the testicles, they end up swelling up. So now it affects those tubes that carry the sperms from the testicles all the way out. So now if those tubes now they get scarred, they can end up becoming blocked. So now, hence now when you ejaculate, it just has the normal fluids, but then there's no sperm in it. So that can also lead to infertility.
What a time to be alive. Dr. Arutara Banaba kuti chimwe chingakonzeresa male infertility. Another cause is chirwere chepabonde.
Yes.
Chirwere chepabonde ndo zvakafanana nema STI, ana drop, ana syphilis, ana gonorrhea. Ndo I think about those zvirwere zvepabonde zvakati wandei. But now, pane mumwe munhu kuti anogona kuzobata chirwere chepabonde. Abata chirwere chepabonde, then munhu he doesn't seek medical attention with an immediate effect. Anovada kuzichengeta, akakula down, akarova shoti rariya rinenge dress zvakakadziya mushana. Tikuti wakomana regerai wakomana because ndo zvichakonzeresa kuti uchaye vana izvi. Andoona because time uchagarewo wakatotukamidza masvada kuzuva uko. Hazvinakidzi nekuti masvada kuzuva aya machi achazvimba. Mukuzvimba kwemasvadazi zvinobva zvadhakwa because ndo panobva paita chii, ndo panobva watanga kutoona kuti ndanonoka kanchimhanya kuchipatara. Ona munhu akaita tsapo rakadai, chamari takazomboona umwe munhu chamari kuchipatara chamwari, munhu bhurugwa raanga akapfeka, munhu mudiki but akapfeka bhurugwa chamwari rinenge men around 15, tsapo yakadai kuzvimba kudai. So ndo zvatokutaura kuti wakomana regerai. And also I think it's nice kuti kana uri munhu wekuti unoda bonde kana maponde stereki, it's nice kuti unga wakaita sei wakadzivirira, because right now tasaone kusadzivirira kuya manje kuchakupinza muna taisire vayo kuti uchabata chirwere chepabonde number 1. Number 2, wabata chirwere chepabonde uchabva watadza kunorapwa nenyaya dzekunyara kana nenyaya dzekutya, uchisina munhu wekutaurira, wobva wada kukula down, woenda kunana mbuya mulambo. Mbuya mulambo ndombero mushonga wakuisirwa dzimwe mushonga dzimwe dzechivanhu zvokuti kule down uite sei, but watononoka unenge wauraya system yako. Iri pamwe pacho futi Dr. da tuchibate futi ipapo. So does it mean if this one is late right now to see the doctor with an immediate effect, is there a possibility of him giving birth to the Down syndromes as well?
No. So my STIs, they don't affect human beings or contribute to children having genetic disorders. But the only thing that they do is that either they can make you infertile, or they can end up, some they end up going into your system, so it ends up becoming septic. Some they end up causing arthritis, especially, for example, like chlamydia.
Chlamydia.
So if you have chlamydia, some people they end up having knee pains. Then it becomes a septic knee or knee secondary to chlamydia. So those are the other side effects of my STIs. But the one year what's on I understand is good. I just want to because my tubes are negative. Takura urume hwako kuti ukwanise kuita mwana.
Nekuda kwaJohn naPeter vanga vachitadza kudzivirira pabonde.
So condom is very important.
Very important.
It's very important.
Guys, we are saying please use condoms. Condoms can make you, safe. Condoms can make you, prevent a lot of things. Especially number one, like what you are speaking about, this male infertility. A lot of males or a lot of boys, a lot of like ladies right now, they might not understanding what we are saying, but that someone that is in that condition or someone that is in that serious, situation can relate to what we are speaking about right now. Waita mukadzi waroora wabvisa mazana remadhora wakula pateni mai mwana ari kubikira maspongido masigiligu baba usungulungu pamhatso wakakula down, but tamba yesi kusvika kuparafini uri kutoshanda basa but hapana chiri kubuda. At the end of the day wagara marriage 1 year, because marriage tichitaura zvedu doctor, when we are saying it, like I think after people get married 6 months is too much. Pamapatone ne result. Am I lying?
No, it's your
After 6 months what of marriage there should be something.
Yeah.
Chocho tokuzoti akona chi pandazviita papa ndikagorogota kandaita sei kada filling up, but kuonowawo 6 months zapera obada futi dzimwe 6 futi dzopera gore dhwa hakuna mwana. Fesi wangu hanzi unenge wafa mushini unenge wafa. Saka ndozvatiri kuramba kuti vakovanikani vatereri varume ngatisafe mushini. Tine zvinhu zvakawandisa zvatirikwanisa kuita kuti tiprevent kuti mishini yedu irambe iri proper, mishini yedu irambe ichishanda zvakaita sei zvakanaka. So papo Dr. Mababate papa I think ane nzeve anzwa, ane meso futi aita sei aona. Saka ini ndakamboitwa hangu karesearch kangu kandakaita, ndakazongotsvagawo zvimwe zvinova macommon causes sezvamataura kuti nyaya pamacommon causes andakabva ndawana inini kuside kwangu ndakaona pane low sperm count. That was number one. So low sperm count can also contribute to male infertility. And then number two, poor sperm motility. Movement is HIV sperms. Ndo panonzitamba inakusvika kuparafini. Kureva kuti pepa ya maspem paachatitsisa paipa. Dzimwe dzenguva simba chairo rogona kushaika kuti zvikomana hazvisi kumhanya zvine usimbe. Zvikomana zvine usimbe hazvisi kusvika kuchi, hazvisi kusvika kuparafini. Wakomana zvakaoma. Then ndobva ndagoogle futi imwe ndobva ndaresearcha. Then pane abnormal sperm shape. Hanzi sperm renge remusoro renge huru kura kudai. Zvinocontribute izvozvo kuita kuti munhu ave nemale infertility. Nekuti John akaonda sperm rake shape rakakura kudai. Ndira chivhayo type ndakaonda kudai, so hazvisi right. Tikutaura kuti papo ndo imwe ingava hodzero yemale infertility.
So usually now how we investigate in males, we will start with semen analysis.
Oh, all right.
Yeah. So usually with semen analysis, the sample lab within 1 hour 30 minutes.
Oh, what I mean
after it has been collected. Saka, what we do now in males who are struggling to have children, so we tell them, okay, in the next 4 to 7 days, you should afana kuenda pabonde.
Oh, right.
Saka unofana ungogara, and then you have to also make sure that you're not taking any external drugs that can affect your sperm count, sperm motility, and all that.
Yes.
So what we normally do, then you ejaculate your semen into a sample, urine sample bottle.
Okay.
Then we take that one to the lab, and then the lab will analyze it immediately under the microscope. And then now, those are the three things that you've mentioned. Those are the three things that we check for.
Okay.
So we look at your semen to see, okay, fine, is there sperm in it? How much did you collect? So normal volumes, it should be around 1.5 mils to 5 mils. Right? And then within that, then we see, okay, is there semen in that? And then how many sperms are there, right, per mil of the sample? And then, right, so patotangira is for sperm or semen analysis.
Okay.
So we collect the semen, send it to the lab. So the lab will look for three things.
Okay.
So first they look at the volume. So a normal man should produce between 1.5 mils to 5 mils of semen.
Okay.
Right, per single ejaculation.
Wow.
Right. And then from there onwards, then we see how many sperms are there.
Yeah.
Because if you have less sperms, the chance of you getting a woman pregnant, they are very low. And then the next thing that we look at is the motility of the sperms.
Okay.
So we need to know, are the sperms moving very well?
Yes.
Or they're moving less?
Oh, okay.
So if they're moving very well, we are happy. But if they're moving less, then chance of you now getting a woman pregnant also comes down. So that's the last thing that we look at.
Yeah.
So we look at the shape
Okay.
of the sperm.
All
Because sometimes you can see that some of the sperms, they have two heads.
Yes.
Sometimes they have a big head or a small head. So all those abnormalities, they will make a person less fertile.
Okay.
Yeah. So then based on the information that we have,
Yeah.
then we can see how best can we help you. And then there's also other things that can also affect the motility of the sperms.
Go
So
deeper.
sometimes we're looking at things like smoking and drinking
Yeah.
or drugs.
Yes.
So that can also affect
Male infertility.
male fertility. Yeah.
So tiri kuti isusu vadikani vateereri, kune avo vanomwa vanoraradza, kune avo vanobhema. Saka pasmoking ati pabate ngoma. Pasmoking zvinobata zvese zvese, kumasigarettes, cigar nekumbanje.
Yeah, any type of smoke.
Even chiroma
Any type of
kuba habli
Whether it's
inobata.
habli, whether it's a cigarette,
Eh.
whether it's any type of
It's
drug
a
that you're
verb
smoking.
as long as you are
So,
smoking.
Yeah, so
It
there's
can
a-
contribute to male infertility.
Yes, so it can contribute. It's a contributing factor to that.
Vakomana panapa imwe nyaya iri kuitika vadikani vateereri panapa. Dhokta wavo vakunditaurira panapa kuti pane zvimwe zvezvikodzero zvinokwanisa kunge zvichikanganisa murume kuti atadze kuita musha. Ndikana tichiti musha ndofunga ndo nyaya yedu yatiudzaurai nyaya yekutadza kuita vana. Saka ndo pamwe pacho panenge pane smoking or substances anorova mbanje, anorova masigarettes, anorova cigar, anorova habli, anogona kutotadziswa nemaitiro iwawo kuti atadze kuita sei, aradze kuita vana. Uye nedoro ratinenge tichimwa, doro iri rakachinjwa naJesu rikaita wine, ndinokwanisa kukonzera kuti uite sei, utadze kuita vana. Tiri ipapo, let's allow me to say this. Alcohol is not for sale under the age of 18. Tikuti susu, drink responsibly because you only live once. So whether you are drinking, make sure you're not driving, because when you drink and drive, there is a disaster that comes out as a result. It can be a loss, death. It can also be critical sickness. Now that can lead to selfishness, because when you can have this kind of situations, vana vachakwanise kuwana mawandiro avanenge vachifanira kunge vachiita. So tiri kuramba isusu vanomwa vachidriver, don't drink and drive, and take responsibility. And then alcohol is not for sale under the age of 18. Alright, saka ndanga ndataura zvikodzero zvekuti kana munhu anenge achismoka neanonga doro hanzi ndo zvimwe zvinokwanisa kutadzisa kuita vana. Saka tiri papo dog. Does that mean alcohol and smoking same time? Maybe I'm smoking and I'm drinking same time. It can be a disaster to myself.
So as we say, you have to drink in moderation.
Okay.
So for us men, 2 glasses of beer a day is normal, right?
Okay.
Then if you drink in excess, then it becomes a problem. So now what we're saying is that smoking and drinking or substance abuse, let me say, substance
abuse, yes.
Right? It can also
be a main cause.
Yes, it can also maybe sometimes hinder you from becoming fertile. But not everyone who does that is infertile or fertile. So it can be a contributing factor as well. So if you drink responsibly, then it's a good thing. But if you abuse, then it becomes.
So ladies and ladies, we are saying whether you are a lady, whether you are a male, guys, when you drink responsibly, because right now, this alcohol or these cigarettes or this weed can make you infertile in a way whereby you don't even know what's causing it. So sometimes drinking with cautious is very important. So please, when you drink responsibly, and when you smoke knowing that at the end of the day, it might be a disadvantage for you tomorrow. So please, ladies and ladies, tighten up your seatbelts because you're about to drive you crazy. Anyway, my doctor, my brother, we can continue now.
Right. Some other things that we look for, interesting, is hormonal imbalance.
Oh, okay.
Right. So hormonal imbalance, it can be caused by, for example, things like brain tumors. Right. So sometimes you can see, you can conceive, but then the fact that you have a brain tumor pressing down on your pituitary gland, which is the master gland for the hormones, and then the next thing now, your hormones are released by the pituitary gland that goes and tells your testicles to release testosterone.
Yeah.
Right. That signal is no longer there.
Oh, okay.
So now that can also lead into less production of sperms, because now your testosterone level is now low. And then also sometimes things like thyroid, like people who have hyperthyroidism or hypothyroidism, they can also struggle with infertility.
Oh, okay.
They can also struggle with that. And then the last thing, it's interesting as well.
Yeah.
There's something that we call sperm antibodies.
So
your body, right? So sometimes when you do the semen analysis, we also look for that in males. Sometimes you can see that in your semen, there are antibodies that bind to your own sperms.
Yeah.
So it's more like an autoimmune disease.
Oh, all right.
So that can also make you less fertile.
Oh.
So we also need to look out for that as well.
Yeah.
So basically, in a nutshell, those are the things that can contribute to male infertility, which are your endocrine problems or hormonal problems, your antibody sperms, your trauma, STIs or infections, smoking and drinking, and some genetic conditions such as Down syndrome or Klinefelter syndrome. So those are, in a nutshell, things that can contribute to male infertility.
Wow. Ish. Think ladies and ladies, bongozi nzwirawo vadikani vatirire ndizvikutaura nadoctor. Uzati chikundakidza ka zvimwe zvinhu vanenge vachitoitira shamari vachitori kumafaro varusikanozivi kuti mangwana zvinokuisa padambudziko. Saka ipapo wagona because kune mwe munhu anotozviita asingazive kuti mangwana rinogona kunge riri dambudziko rake. So magona mapabata ipapo makuruwani. And then now pane nyaya yangaida kubvunza. So now kune mwe munhu ari kutoona, there is someone that is watching us, is going through the same situation. He has been married for a decade, he has been married for some time, he has been married for a year. Now, this person, it is happening that maybe the wife is having a child, the husband is having a child, but these people on their own, they don't have any child. So, one or both of them might want to know what are the steps that they should take, especially on that kind of, on that kind of a situation. Also, pane wemunhu arorwa vesa vana but havazokwanisa kuita vana vari pamwe chete. So uyu hamene totanga neuyu anga ane mwana kusaidhi here kana kuti totanga neuyu avasina, ngatitange nevasina toko. Let's make it clear kuti avasina. It's been a year, it's been 4 years, it's been 5 years, because chimwe chinhu chiri kukonzera doctor chandiri kuona, some people, they have different beliefs as well. So also, I feel like religions can kill us as well, in a way whereby sometimes these people, they have their own belief. Right now, you understand? With this concept, some people, they can say, I don't believe in that. But right now, I believe kwake kunenge be something like this. So don't answer. Azive kuti, yes, no matter how good we can do, God is the greatest. At the end of the day, kune munhu ari kuona, munhu ari kuteerera, ari kuita going through those things. Vakarorana, 1 and 2 years, 1 and 3 years vari marriage, but hapana mwana aripo. So chakudiwa apa vanhu ava vanofanira kuita sei?
Alright. Saka patinotangira.
Patinotangira.
Tinoona murume nemukadzi. Sevarume, sezvataura kuti we do that semen analysis.
Yes.
Right. And then we also need to examine mukadzi.
Yeah.
But sometimes maybe murume anenge ari right, but problem iri pamukadzi. Or mukadzi ari right, but problem iri pamurume. Saka taexamina murume, now takuexaminawo mukadzi. Saka kuti mukadzi akamboita mwana kana kuti vana, but hana, asi now they are struggling. So muvakadzi also tinoitawo my investigations atinoita.
Okay.
Kuona kuti what is wrong, and then depending on what's wrong, then we would treat them accordingly.
Okay.
Yes.
Saka toti gora tikatimboimira takadaro tomupinda kuvakadzi handiti. Saka tipinde kuvakadzi. Also katabva panyevakadzi tozobata yandoda kuti bate later. Saka tiudzei kuti iri common causes evakadzi atakaito research. Panga pane ovulation disorders. That was number 1. It is shortened PCOS, premature ovarian failure, hormonal imbalances as well. Then over number 2, uterine issues. Then by uterine issues are ma fibroids, ma polyps, the scar tissues. Then kuvakuita cervical mucus problems. And it's what 3% page here.
Yeah, 3% page.
Then the last one, which is fallopian tube damage or blockage from infections, which is the same thing that rambotaura yema STI. Yamabata pavarume kuti inokwanisa kunge ichibloka futi ma tubes. Zvinongwa chimwe zvezvikonzero zvinoita kuti pasave nevana futi pavakadzi. Saka ngatibate ipapo mukuru wangu. Totisisu pama ovulation disorders apapa. Zvii zvinenge zvichifamba sei?
Right. Saka tautasa kuvakadzi handiti totarisa chibereko chavo. Saka tikonotangira kuma ovaries.
Yes.
Right. Sama ovaries ndomenge mune mazai.
Okay.
Saka mazai anofanira kudevelopa, anofanira kumature. Once amature, then rinenge riri dominant,
okay,
ndorinoriliswa.
All right.
Handitika. But now, for this whole process to happen, it's controlled by my hormones.
Okay.
And vakadzi vane progesterone ne-estrogen.
Oh, all right.
Saka ndo inocontrola zvese.
Yeah.
Handisika. Saka, so anything that causes hormonal imbalance in women, it can affect ovulation, which is the release of the egg.
Okay.
Saka, these things can be thyroid, the same as in men. It can also be my brain tumors, the same thing I explained, the same as in men. Because in our brain, the pituitary gland don't release our hormones, and also no my ovaries could produce progesterone and estrogen, depending on the part of the menstrual cycle phase we at.
Okay.
Saka, if there's that hormonal imbalance, then you find out kuti my eggs inside my ovaries, they don't develop very well.
Yeah.
And this will lead to a woman not being able to ovulate. Saka, this can end up affecting fertility of a woman. Saka, hence now, if we find kuti there is a brain tumor, we remove it, she'll be fine.
Okay.
If we find out kuti maybe she's deficient in one of the hormones, we can give it to her so that my ovaries are not developed. They make those eggs develop very well, and then the eggs they get released. And then tobacco hormonal imbalance. When the egg is released from the ovary, it has to travel down my fallopian tubes before it comes to uterus.
Yeah.
So now, if she had a history of STIs,
yes,
especially in women. So women, if they have gonorrhea or chlamydia, they might not know it. So it sits there at the cervix, then it starts to climb up up the uterus, and then it goes up into the fallopian tubes, and then now it scars them. So now they end up having being scarred. So now there'll be fluid collecting around them. Now when the egg tries to pass down to the fallopian tubes, it can't anymore, because now there is scarring that happened. So it's no longer as smooth as it was. So she can tell you, maybe I'm ovulating, but there's no egg available for fertilization because it cannot move down into the uterus from the ovaries. Saka, this is the problem of STIs. And this is actually the most commonest cause of infertility in women because of these STIs. So we end up calling it PID, pelvic inflammatory disease. So they'll have pain in the pelvic area. Sometimes it's difficult to treat.
Okay.
But once it's complex, then chance of them getting pregnant, they are slim. Very, very slim.
So tiri papo dog panimana ndibate is a sensitive topic baba, but pane munge munhu pamwe anogona kunge achitone STI ari munhukadzi but haazizive kuti anayo. What are the signs and symptoms emunhukadzi yekuti kana ane STI azive? Because right now I can relate kuti since mati mimi kune mukadzi zvinokwanisa kunonoka kubatika sekumunhurume, because munhurume akangoita STI zviri easy because sikarudzi yake iri padzi. Pakune munhukadzi sikarudzi yake iri kuenda mukati. So now, how does one know ari munhu wechikadzi kuti she's having an STI?
So my symptoms of that, number one, is that they will have what you call vaginal discharge.
Vaginal discharge?
Which is abnormal. Because women, they have normal vaginal discharge depending on which day of the cycle, their menstrual cycle they are on.
Okay.
Right. So it can be like egg white. You know that egg white, then you know they are ovulating, and then to more like whitish but watery.
Okay.
But now, can I have STI infection? You see that discharge becomes yellow, becomes green, and becomes foul smelling. So it'll be smelling bad. So those
like when you are saying it's smelling bad, how bad is it smelling?
So women, they know that this is their discharge. This is the normal discharge, right? But now, the moment it has a smell, a bad odor, smell to it, they will know that this is wrong. There's something wrong with this.
What triggered it out, doctor? One time to be alive. Chi. Kana iri bed odor iyi. Ababa mukadzi watukutaura nezvake but mukadzi ane murume. Pamwe zvingwa mukadzi pamwe arikutowanzira murume haasi kuketi. Tobo side kumurume kuti aziye kuti kana akadzwa smell iyi kai. Azoti mukadzi uyu zvapachi mukadzi ari kurwara. You understand? Saka tibate ipapo kuti kune murume ane mukadzi wake uyu ane STI but mukadzi akaiwa because I'm sure there are types of STIs but it's going to be another topic for another day, right? But then pama type of STIs atinawo pane mama STIs ekuti vakadzi ava muise vaginal STI imwe inotita stomach STI handiti ndizvo
Yeah.
pane STI yemudumbu ndizvo.
So what we call it is the one that causes that it affects the liver.
Yeah.
Saka it will be chlamydia.
Chlamydia.
So chlamydia, yes. So it ends up even affecting.
Someone popcorn arapo. Popcorn, are you there?
100%, bro.
International standard. Popcorn anogona ngane mukadzi. Mukadzi pamwe ane STI dot. But mukadzi arikutoziya kuti STI ndinayo. Maybe akatombotambawo kwaakandotamba. Asi STI yake haisi kupera. Pane zvinokwanisa kunge zvichiitika here kuti uyu azive kuti mwana STI. Alright, why ndiri kubvunza mubvunzo uyu? Popcorn anokwanisa kunge akacircumcised. Akacircumcised machances ake kuwana STI kubva kune mukadzi wake. They are less compared to munhu asina kucircumcised. So vanhu ava they can stay together for a period of 2 to 3 years. Asi mukadzi watore STI kuti mukadzi akatorana nemwe munhu asina kucircumcised anotorwara same time. Saka popcorn kuti azviziye kuti mukadzi wake uyu ane STI handiti odor iyoyo that's what we want to get it deeper dog in a way kuti he has to know kuti kana akanzwa munhu uchinhuhwa se then this young man now he will be wise. Akutogaradza kuti mukadzi wangu ati munhu nachiremba vanhu takutoya pasejari yenyu dog pakurohwa nyama nefoku iyo kumugirasi patakakula down. Saka tinofanira kuti tibate papa kuti uyu kuti azoziva kuti uyu munhu uyu because mataura imi mukati munhu uyu it will be bad. It's a bad smell. That's when you realize kuti if the scent of that smell is that bad in the way that you are saying. Taonakana nefesi yenyu dog pamati bad smell. Manasonoza kuti smell iyi kai smell inenge singaiti. Saka kuti aiziye smell iyi anofanira kuti anozoona sei.
Right. So zvinoitika ndezvekuti it's for us who are in the medical field, it's experience, right? Because when it comes to the smell, there is the one that is caused by the normal microflora. So that is the normal bacteria that sits on the vagina.
Okay.
Right. So sometimes, for example, if the yeast becomes less, right, and then the bacteria grows too much, you have what we call bacterial vaginosis. But now that bacterial vaginosis is not an STI, but it's characterized by a fishy odor smell.
Okay.
Right. So especially after ejaculation, after it becomes worse. Right. Then you know good. This is bacterial vaginosis, but which is not an STI. Right. But with them women, the best way to know is for us men, because right, and the urethra is very long. So at the moment, right, within some men they experience the same symptoms on the second day. Some with, let me just say, between the second day and a month.
Yeah.
Right. Once you start to feel that itchiness inside your or you start to see discharge, then you know good to know. Within that time frame, STI. But when it comes now to women, because in yabo, so they know kuti this is the normal discharge that comes out, or this is now out of the normal. Saka most likely women will be able to tell based on that.
Okay.
And what? Saka usually now what we do is when we're treating them as partners, right? The treatment is we normally base it on the male.
Okay.
Because if the male symptoms disappear, that means the medication worked. So that means if we give the woman the same medication, it will also work. But if that medication does not work in the male, then that means most likely didn't work in the female.
Saka tiri kuti isusu chikomana ichichi chikanzwa munhu wefish, that's how bad you describe it.
That one is normal.
Munhu
Then
wefish.
you know it's bacterial vaginosis.
Saka Popcorn, are you there, my brother?
In the building.
Saka tiri kuti iwo hanzi kana ukanzwa munhu wehove fish scent zviri normal, it's what we call bacterial infection.
Bacterial vaginosis. Yeah.
In other words, it's bacterial vagina
Vaginosis.
or vaginosis.
Yeah.
Vaginosis. Kuti dzakupere baba. Isa. Shit, I'm gonna down. Isa. So tikuti isusu pamadhira aya manje chinobva chazoitika inyaya yekuti uchadzomwa kwachinhuwa fish hausabva wambopotera ukunhuwa hove, but hove inozonzwika kana after mese manzi kana ma-ejaculate same time.
You can become worse there. Yeah.
Handiti kuejaculate nemuchishona ndo panotaura kuti kana mese muchinge maita se muchinge matuta amai nababa. Handiti mai nababa kana muchinge matuta zvinobva zvaita zvinhu zvakanaka kuti after mai nababa watuta panozonzwawo mukadzi kana mese wakungonzwa kuti mugupezi mukunhuwa mweya wehove, ndipo panodiscover chisimeo chatiri kutaura ichi chinenge chehove ichi. Handiti saka tikutaura isusu tichiti that's vaginal.
Bacterial vaginosis. Yeah.
Saka isiri vaginal bacteria iyi inenge chinhuwa sei, doctor?
So it's not fishy odor.
It's not
Number
fishy
one,
odor.
Yeah.
But
Saka
what I want to understand is the odor, is it loud?
So in an off scent.
Okay.
I don't know how to describe it.
All right.
But if you're in the field, you can tell.
Okay.
You can tell. So in an off scent, and then you also look at the color of the discharge.
Okay.
So you see whether it's green or it's yellow. Saka it will indicate towards an STI. But then if you want to know specifically which STI, that's where we involve the lab. So we take that swab and then we send to the lab. Then they'll tell us, this is this bacteria causing this, and you can use these antibiotics to clear it off.
All right.
So that's basically the nutshell for my STIs.
For my
That can
STIs.
cause women
Infertility.
become
So to put
infertile.
this pawakadzi in females, when they have these STIs for a long time, it can lead to female infertility.
Yes.
Whereby one, it can be delayed to have a baby, or she can never have one.
So she can, but through assisted reproductive technologies.
Okay.
Yeah, but then through natural methods.
So let's say
chances
by
of
that
getting pregnant is less.
assisted technology yatiri kutaurai kana yakuitwa assisted iyi, is there possibility yekuti munhu atozvara mwana akasvika kana kuti anotozvara Down syndrome?
No, antozvaramwana are right, but remember Down syndrome, it depends like at what age.
Oh,
if you are
okay.
40, if you're above 35, the chances are they're a bit high compared to the person who's 26 or 25.
Oh, all right.
But otherwise, through assisted reproductive technologies, chances of them getting a normal baby, they're high.
Okay.
They're high. And then also now, after the aspect of my fallopian tubes, some women, they have my abnormal uterine, like what you've mentioned.
Yeah.
So it cannot hold a child.
Yeah.
So that can also be another problem of infertility. And then you also mentioned about there can be other structures inside the womb, such as my fibroids.
Yes.
Right, which can also make implantation of that fertilized egg a bit difficult, which can result in also infertility. Or maybe they have aborted, like abortion, they've aborted the child, and then during cleaning, right, the process, it ends up scarring the womb, where they end up getting what you call maladations. Right? So that can also result in infertility. So these are things that we need to look for. And then also cervical mucus. So remember, a sperm, it's foreign when it comes to the womb. So the woman's body will try by all means to try and stop it. So hence sometimes they have too much mucus that makes difficult for the sperms to swim. So that can also result in infertility.
All right. Saka tikuti isusu vadikani vatereri tikutaura tichiti kune vanhukadzi kubvisa mimba it can cause you to be female infertility.
Yeah, it can cause female infertility. Yeah.
So vaiva vanobvisa pamuviri vaiva imbomirai vasikana regerai kubvisa pamuviri because zvinokonzera female infertility, number one. And then number two, John niwe ukachizvibatawo zvichakonzeresa kuti mwana wawana aite sei abvise pamuviri, and I think anozochema neofuti mangwana, which is something that is not okay. So ndopakati tibate dog, because I've realized, especially of this topic, that a lot of people, they are going through some things that they're thinking that is normal, but at the end of the day, they need counseling. They need help so that they know, but it's not normal for me to have a girlfriend, to have a wife, and I'm living with her under my custody for about 2 to 3 years. We don't have any kid. And according to them, it's lucky. It's normal. At the end of the day, vanofana vachiziva kuti patine problema pakutoda Jesu, pakuda help. Saka patotaura vadikani vatereri, if you are facing this kind of situations that we are mentioning right now, it's high time for you to seek medical attention. Right now, I'm having a medical practitioner, which is my friend, Dr. Eddie, and his surgery is not so far. It's located in Johannesburg, Cape Town Park, CBD. By the end of this episode, I will make sure that the details, they are also on the screen. So, vadikani vatereri, kana uchida go through those things, please, you need medical attention. Right. Then, but anyway, issue Dr. Akashidotibati. And then I have witnessed that. I have witnessed that in a way with Dr. Ndakazvionera pamhino sefonja. Kune imwe situation yafane iyi. Popcorn ari kumhanyana spice wake. Hapana zviri kuitika. Asi spice uyu toda popcorn ane musikana kubva vanorohwa ngachafa. Ifight. Handiti. Then deposit kwekuti popcorn na spice vake vasiyana. Handiti. Popcorn asiyana na spice wake. Pozita kwekuti popcorn atone chimwe chibhebi chakumhanya nacho. Spice atone mumvesa kwakumhanya nayo. But after 1 year, mwaruko. Vese uyatobitiswa. Asi panguva vese hapana mwana akaitika. Chii chinonga chiri chikodzero panyaya iyo?
Right. So the third class, and that is there is primary, there is secondary, right? Then there's also unspecified. So sometimes you examine both men and women, right? Then you find out there's nothing wrong with both of them. You've done all your investigations. You see, good to know they're both capable of having kids, but then it's not just happening. So sometimes that one nobody can explain it. So hence that's why we say it's unspecified. Right. So that's when you find out, good to know, they come to you, tell them like, no guys, sir, here are your results. You are 100% fine. You can have kids. Ma'am, here are your results. Your ultrasound, it's clean. Your HSG scan, it's clean. There is nothing wrong with you. And then your menstrual cycle, it's normal. You're going to your periods on every either 21-day or 28-day cycle. But then it's just a matter of chance.
Right.
For some people, they are religious. So they tell like, God will make it happen for me.
All right.
So that's when you see sometimes it goes that way. Yes, God, He might provide us to help you, but then He has the final say. So that's when you see like this couple, they've been together for a year, they couldn't have a child or even 2 years. But then the moment they separate, then you hear, within a year, this one has a child, this one now has a child.
Yeah, because I've witnessed some cases that I had witnessed in my life, whereby these people, when they are dating, they can't have a child. And trust me, those people, they are both believers in Christianity. They are going to church every Sunday. It's Adam and Eve that we're talking about. These people, they're loving. But then, after the breakup now, Stephen is going this way, Nelia is going this other way. Stephen is going to date another person. Nelia is going to date another person. Nelia is going to fall pregnant. Stephen is going to impregnate this lady. Both of these people, it happens that these things, they happen same time. But while they were together, you'd be surprised, there was no spark, no magical moment, no fire in the bedroom. You understand? So that's why I had to ask you, Kuti, how possible is it?
No, it is.
It is possible.
It is possible. Even sometimes you bring the couples to the examination room. You examine them, you give them the results. Then you be like, look to the lady, this is your HSG results. Your fallopian tubes are perfect. Everything is perfect. Then there's no any reason to explain why you can't conceive.
Okay.
So it's normal. Sometimes you come across that. Then it's just a matter of chance.
So now,
it's just a matter of chance.
Now let's talk about now how we can test on both females and males. So because we don't have no males, females as we don't have females right now, but what we can just do is we can start by the male test, because I'm sure if we have females in the house, it was going to be an easy way for us also to ask them if they are having any type of question that they would love to ask, they'll be free to ask. But now, because we don't have females in the house, I think it's wise for us to start with the male vision. But how do we test?
So for men, we do the semen analysis.
Yeah.
And then with all those criteria that we mentioned, including the sperm antibody.
Yes.
Right. And then once everything comes out clean, then we'll be like, you are fine.
You are fine.
Then now, when you go to the women now, so the first thing that we need to do, we need to also do the blood profile.
Blood profile.
Right? So to check, is there hormonal balance? There's no tumors, the thyroid is normal. And then also the progesterone and estrogen hormones are normal. So once you see that the blood work is normal, then we do an ultrasound to look at the whole womb, to see the fallopian tubes, are they clean? The womb, is it clean? There are no fibroids or anything, right? And then the last test that we do is the HSG scan. Okay. So this one is more like an X-ray, where we inject contrast into the womb, and then we take a series of pictures to see if that contrast that we've inserted through the cervix going into the womb, it has to flow into the fallopian tubes and then out through the ovaries. So if it spills into the abdomen, then we know that the tubes are not blocked. So if the tubes are blocked, let's say maybe due to STI infection, then the contrast, it will not spill into the abdomen. So then you see where it stops, where the cutoff is. Then you can tell the patient, mommy, I'm sorry, you can't have kids, your tubes are blocked. Because then that means the eggs cannot go through. Same thing as the sperms, they cannot go through. Yeah.
Vadikani vatereri ichaile iskati udhokotera ufune kuhamba konapo would leave your comment in our episode uzobuya nenye vadikani vatereri. What a time to be alive. We love you. Mic&PurposePodcast uze nenye gunanzi konapo umpatilizwe.